I've known for a long time because this has been progressive arthritis, probably brought on by doing too much soccer and rugby over the years. 2 years ago I had to stop playing soccer because I couldn't run around the soccer pitch anymore. And then walking the dog became more and more of a challenge to me. I was struggling to get in and out of the car, and I realised that the time had come. I had a total hip replacement, and I had the anterior approach, which is the more modern hip replacement, where they're going through the front. And my surgeon was quite keen for me to spend a reasonably lengthy spell in hospital. By lengthy, I'm talking about a week or so.
I'm currently a rehab physiotherapist, which provides services for my patients post-surgical rehab, such as total hip replacement, total knee replacement, and other home care services. Rehabilitation in the home have a lot of benefits for our patients, such as reduce their hospital stay, so the risk of infection will be minimized. And then our patient can go home to their pets and their loved family, so they can rehab in a more comfortable and familiar environment.
Rather than being tied up in the system and having to worry about appointments and who's going to see you and when and how it's going to get changed. I know that every Wednesday Claire's going to come along at the same time and I'm going to get the appropriate treatment, and I know what to expect, and it just feels so much more personal and suited to me and my needs and my progression.
I think as a physio, it's very precious. Like, you can work with a patient one-on-one because you can just see how much progression they have made, we made our goal at the beginning, and then we try to make further steps to reach that goal. So it's very achievable for both of us. Andy has been recovering really well, more above my expectation. So our plan for today is going to continue our hip strengthening exercises and our outdoors mobility practice, because Andy has a very hilly road outside the house. So we're going to do our walking practice more than 500 meters. So that's our goal for today.
Ruby is a very senior cattle dog that my wife and I have had for about 11 years now. Ruby is going to be very grateful because Ruby's not very mobile, and she leans on me a lot to move around, carry around, push around in her pram. So she's going to be very keen to see me back so I can start taking her on walks again. Yes, I definitely recommend it. It's having the rehab at home has been hugely beneficial for me. I feel like it's very personalised treatment, which works for me, and rather than me having to work in with hospitals and clinics and seeing different people and worrying about how I'm going to get there, it comes to me, and it's a very personalised treatment which has been tailored to my needs and is continually monitored according to my needs and changed accordingly. It's all about me, which sounds very self-centered, but then when I'm going through the surgery, I suppose that's what we need. So yes, I'd recommend it to anybody.